this amendment very strongly. I've kept an eye on it. I'm not on that committee, and my attention was brought to the gaps, if I can use that very bad word in this context, because it's full of gaps, the whole thing in relation to the provision of dental services. But Minister, I think you're aware how I became aware of this in Galway as a result of a particular case. I'm not referring to the case, and in fact I understand that person did their damnedest to provide a service, notwithstanding the ill health in question. But what really was brought home to me was the failure of the system to deal with a situation where somebody got sick. That was one aspect of it, and the Dental Council was saying it was up to the person who was ill to deal with it. And then I became aware of all the other gaps and the failure to have ongoing education, which is really the most basic requirement. So I just wanted to come in on that basis. I want to thank the Deputy for bringing the amendment, and I support the amendment. Thank you.
Minister, to respond.
Thanks very much. To Deputy Connolly's point, I take your point, Deputy. The continuous professional development piece is not related to that case and wouldn't have had an impact, but I take your point.